Hi guys, how's it going? It's Bandit Stephanie here. It's Monday, April 18th, 2016. You guys last heard of me a couple weeks ago and I came back to announce to you guys that my husband and I were expecting our first baby, and I kind of wanted to document my whole journey through being a post-op lapband patient, having plastic surgery, and now becoming pregnant. So let's see, I was banded in March of 2011, so I'm a little over 5 years post-op lap band. I had started my journey at about 314 pounds, so along the way I'd lost about 150 pounds. And then I also had, in terms of plastic surgery, I had a breast lift and implants, and a brachioplasty arm lift, and then a body lift 360. So the last of any of that was about 4 years ago now. So now I am just about 28 weeks pregnant. So I kind of wanted to track, my journey of pregnancy, being a post-op weight loss surgery patient as well as a post-plastics patient. It's something that is good for me. It's good for the community. So I wasn't around last weekend. I was traveling for my husband's 40th birthday party. And I normally weigh myself every week and then I measure my belly, but I wasn't around, so I didn't sweat it. So I did that this past weekend. And I weighed in at 199.8. So I told you guys last time that I started my pre-pregnancy weight at 175 pounds. So I'm now up about 24.8 pounds in about 28 weeks. So I'm getting close to that lower end of the threshold of the 25 to 35 pounds that they recommend as a normal weight gain during pregnancy. So I think, with about 12 weeks left, I'm at the stage where I will probably gain about a pound a week. So let's say maybe another 12 pounds, so maybe 37 pounds. I'm thinking maybe max around 40. So for me, being a weight loss surgery patient and coming from a place where I was 314 pounds, in the whole grand scheme of things, that's not that bad. I've lost the weight. I know how to lose the weight. Of course, going into it, I automatically thought I'm going to gain 150 pounds in 9 months, But I told you guys last time that I've been continuing to watch what I eat, continuing to exercise where I can. So this video, I'm going to focus on post-weight loss surgery and pregnancy eating. So, they kind of recommend somewhere around 300 extra calories a day when you're pregnant. So being a weight loss surgery patient, you're already eating a lot less than a normal person. So when you become pregnant, there's a list of kind of do's and don'ts with your food. And it's interesting because so many of them are actually very similar to the weight loss surgery rules, where with a lap band, smaller portions. For me, I would eat throughout the day, high protein, high fiber type of meals. It's the same thing. So my pregnancy diet, really hasn't strayed much from my pre-pregnancy diet. There's a couple of things, I guess. During my first trimester, I was pretty sick. So at that point, it was kind of, survival mode where if I could just tolerate a milkshake or something like that, I didn't eat much. But, that was really hard for me because I've been in a routine for 5 years of, the same breakfast, the same types of foods. And then to kind of not be able to eat that anymore was a little strange. But come the second trimester, I was able to kind of get back to my normal routine with a couple of exceptions. So being a lap band patient, my lap band is generally pretty tight in the morning and then opens up as I go throughout the day. So I would usually just eat like a Greek yogurt for breakfast. But now I find myself waking up hungry. So in addition to a Greek yogurt, I'll also eat oatmeal. And also a big factor in pregnancy that I've been experiencing is heartburn. So one of the main things to kind of reduce or try to lessen the heartburn is eat smaller meals. So obviously something that I'm used to. So that's what I kind of do throughout the day is, eat a little bit at a time. It also helps with my lap band. I don't have any issues with being too tight or eating too fast with that kind of eating. So that's all been pretty good. But like I said, it's not much different where I'm eating high protein, high fiber things, because with the prenatals that they have you take the vitamins, you know, sometimes it's similar to like right after you get weight loss surgery where, you know, you are out of a regular routine of going to the bathroom, and so some of the prenatals can cause that too. So high fiber is really important. But you know, there's a couple things I think that I do now that I didn't as much pre-pregnancy, which is like cereal has been kind of a big craving in my pregnancy diet, I guess. But you know, I'll use my Carb Master milk that I buy from Kroger, and then I will usually find like the Special K extra protein cereal or Kashi. You know, I don't buy any of the other stuff, and so there's things that I can buy, you know, in my learning over the years of, you know, kind of the good foods versus the bad. So still I can easily incorporate that type of stuff into this diet, and I don't give myself that excuse that you can eat whatever you want, because you know, seeing as I've lost all that weight, I know how hard it is. So I'm really trying to watch that. But there's an added factor, I guess, in my situation where we're working on a kitchen remodel. So basically my kitchen is completely gutted, as you can see. So I can't cook right now. So that's kind of an added thing. How, you know, what do I eat? I have some pre-cooked meals that I've frozen that we will unfreeze, or you know, as of right now, until I get appliances and a sink, we eat out a lot. But you know, as I kind of know over the last 5 years, you can make good choices when eating out. So you know, that's not as difficult for me. I always have leftovers. I always eat generally pretty good, but it just adds to the whole factor and the whole difficulty, and it just kind of shows, you know, life is what it is and you have to deal with it. So, you know, you do the best you can without giving up the struggle and just, you know, caving and giving in, because that's not something that, you know, I want to do. But I know a couple of you last time asked to see a belly pic, so I think I'm in a light where hopefully I can show you guys. So as I said, I'm 28 weeks pregnant. So here's side shot. So I'm a little over 6 months pregnant now. And you know, as I said, my tummy tuck, my 360, I think still has kind of held me in somewhat, you know, in my belly area because of the tightening in the muscles and whatnot. So it's definitely a baby bump. You know, and over the next 12 weeks, I'm sure it'll grow quite a bit. But as I did when I was losing the weight, measuring my belly, I do that now every week with the pregnancy. So I think I've gained about 8 inches around my belly since finding out I was pregnant. So interesting to track the weight and track the measurements, because obviously, you know, that would have been nothing. I would have probably done pre-lap bands, you know, I wouldn't have really worried about it. But it feels good to kind of be in control and know that at some point, you know, it's out of my control to a certain degree, but at the same time, I can control what I'm getting, and I can feel good about the nutrients and the foods that I'm feeding the baby. And honestly, that's huge for me. So I think that's about all I wanted to talk about today with, you know, post-op lap band. 28 weeks pregnant, just now entering the 3rd trimester, so it's gonna go by pretty quick. And eating in pregnancy, and probably my next video I'll do on exercise in pregnancy post weight loss surgery. So I appreciate you guys' comments and well wishes, and I look forward to talking to you guys again, and hope everybody's doing well. I'll see you guys in a week or so. All right, take care.